Hello, everybody. Thank you so much for joining us tonight. I'm going to give it a brief moment. I see everybody coming into the waiting room, and then we are going to promptly get started with tonight's program. Thank you so much, everybody. Okay. Well, it looks like our waiting room is working, so I am going to get us started in the interest of time. Hello, everyone, and thank you so much for joining us for tonight's program, The Role of Cognitive Behavioral Strategies in Pain Psychology and Managing Pain Associated with Tourette Syndrome and Other Tic Disorders. My name is Alexandra Walsh, and I am the Manager of Programs here at the TAA. My colleague, Chantel Campbell, Manager of Medical and Scientific Programs, also joins us tonight, and she will be assisting me in the Q&A portion of tonight's program. Participants will have the ability to engage in a Q&A discussion with our presenter after the presentation, and you can feel free to place your questions in the Q&A box throughout the presentation. As we start the Q&A, we ask that you please take the time to use the QR code displayed on the screen to fill out a brief survey about tonight's program. The feedback you provide us on our programming is not only greatly appreciated, but it allows us the ability to host more programming for our adult constituents in the future. Tonight's program will be presented by Dr. Sarah Love. Dr. Love attended graduate school at Wright State University School of Professional Psychology in Dayton, Ohio. During graduate school, she obtained clinical training through rotations at Cincinnati Children's Hospital Medical Center and Dayton Children's Hospital. She completed her pediatric psychology residency at Nemours Children's Hospital in Wilmington, Delaware, and graduated with her doctorate of psychology in 2020. She then completed a fellowship at Akron Children's Hospital, where she provided clinical care through the inpatient consultation and liaison service, the pain center, the headache program, and sleep medicine. Dr. Love is currently a pediatric psychologist at Akron Children's Hospital within the Department of Psychiatry and Behavioral Health. In her current role, she provides behavioral health services within interdisciplinary teams in neurology and the headache program with a focus on non-pharmacological pain management. She also serves as an assistant professor of pediatrics at Northeast Ohio Medical University. With that being said, I'm going to pull up tonight's presentation slide, and I'm going to turn it over to Dr. Sarah Love.
Thank you so much, Alexandra, for that introduction. And I want to thank everyone for tuning in during their busy evenings tonight. I'm really excited to talk with you all about the role of cognitive behavioral strategies and pain psychology in managing pain associated with Tourette syndrome and other tic disorders. We can go ahead to the next slide. I'll share a little bit about my journey as well and interest in this area. From a professional standpoint, as I started working more and more with folks with chronic pain, I began to see this relationship between Tourette syndrome and tic disorder in a lot of my patients who are presenting with pain in different parts of their body, as well as pain related to tic disorders. On a personal level as well, my husband has a right shoulder tic that causes a lot of significant pain, especially when the tic has been really frequent throughout the day. And so this is really something that's both a professional and a personal interest for me. My goals for us today is that we talk about the relationship between tics and chronic pain, why that relationship exists. I also want to spend some time really explaining what is pain psychology and what is cognitive behavioral therapy for pain, and how we can use some of those strategies to help with managing some of the tic-related pain. My goal as well is that you leave today with a couple tools in your toolbox that you can use to apply and help reduce some of that pain. So we'll get some skill practice as well. So we can go ahead to the next slide. When it comes to chronic pain and tic disorder, we see that this is such a common experience. And I know for many of you in the audience, it's something that's part of your day-to-day lived experience. We know that chronic pain is incredibly common. Oftentimes, when we look at the literature, the estimates are greater than 50% of folks experiencing chronic pain. We also know that this is an area that's still, unfortunately, relatively under researched. So it's an area that needs more research to be done. But from what is out there and what we know, one of the biggest reasons why we see this relationship between pain and tics is related to the repetitive muscle movements from the tic. So we know that if someone is experiencing a tic and it's occurring frequently, it's engaging, either one muscle group or multiple muscle groups. Having that activated over and over again can lead to a lot of pain. And we'll talk about in a little bit some of the other reasons why we may see this relationship too. Aside from chronic pain being incredibly common, it's also incredibly impactful. So we see that folks who have Tourette syndrome and tic disorder find that that pain really impacts daily life, social relationships, activities, well-being, mental health, functioning. So it's something that's really prevalent and really impactful. There was a survey that looked at folks who had Tourette syndrome and tic-related pain, and they found that 87% of the respondents were indicating that the pain was really negatively impacting everyday life. So it's something that we really want to be able to offer intervention and support around. We can go to the next slide. Some of the other thoughts behind, why this relationship exists. Like I mentioned earlier, we know that the repetitive muscle contractions from tics can lead to increased pain. We also know that tics, especially when they're frequent, can increase muscle tension, and it takes just a little bit of muscle tension to increase pain. We also know that when folks are attempting to try to suppress a tic, that can also lead to increased pain sensations. Some folks may also experience injuries from the tic itself, especially folks who have more complex tics may inadvertently injure themselves during the tic, and we know injuries can be painful. So that's another reason that we see that relationship. Aside from some of the aspects kind of related to the tic themselves, we also see higher rates of a couple of disorders that can lead to chronic pain, especially in folks who have Tourette syndrome. So specifically, we see higher rates of generalized joint hypermobility. This can cause pain within the joints themselves, as well as more widespread body pain too. And then we also see a higher prevalence of migraine. I myself right now work a lot with patients who have migraine, helping them learn non-pharmacological pain management strategies. And many of my patients also have Tourette syndrome as well. And so we see higher rates of a couple of chronic pain conditions, as well as aspects of the tic themselves. So we can go ahead to the next slide. Some of the research that is out there has looked at that relationship more closely between tics and pain. Taylor, Anderson, and Davies proposed a tic pain cycle. So this is their sort of explanation here of that relationship between pain and the tics. So we see that in this cycle, the tic happens. The repetitiveness of that tic leads to more pain. The pain then can trigger more tics, so that pain sensation can increase the tics themselves. Like I mentioned earlier, sometimes tics can lead to injury. That injury itself, that increased pain, seeing that injury can also then lead to more tics and then more pain. And so this cycle just sort of shows us a little bit on that relationship there. You can go ahead to the next slide. So I want to shift gears for the next part of this presentation to talk more on cognitive behavioral therapy, how it's used for pain, how these skills can be applied, and to also spend some time talking about pain psychology as well. So we can go to the next slide. So you may have heard of cognitive behavioral therapy before. It is one of the most evidence-based, well-researched treatments in psychology. The whole idea behind cognitive behavioral therapy is that how we think is really connected to our emotions and how we feel, which is also connected to our behavior, what we do, our actions, how we cope. With cognitive behavioral therapy, this is a treatment that's utilized for a wide variety of different disorders, including things like anxiety and depression, but it's also used for physical conditions and health conditions too. When I'm using cognitive behavioral therapy, I'm using it and applying it towards the management of pain. And we'll talk specifically about, what are those strategies and aspects of CBT that's really helpful for pain. But this little diagram that I put together here shows us a little bit of that relationship between our thoughts, our feelings, how our body reacts and responds, and how we behave. So if we're thinking about someone who's dealing with pain day after day after day, naturally they're going to have negative thoughts about the pain. It would be strange if they weren't having negative thoughts about that pain. So we see commonly negative thought patterns related to the pain. Someone who's dealing with pain day after day may have thoughts like, nothing's going to help. This pain is never going to go away. And we know that when someone is having a lot of negative thoughts, they're happening often, that's going to impact their mood, right? And their emotions. So they're going to feel more stressed or feel sad, have a more low mood. How we feel really shows up in our bodies. Our emotions are really physical. How our body reacts and responds related to that thought and that feeling. We may notice that we have increased muscle tension. We may notice some more physical sensations of stress, heaviness. We may also see increased pain, and we'll talk about why that can occur. And we may also see increased tics as well. So when they were looking at the relationship between pain and tics, they found that as negative emotions occurred, tics could occur more often, and that can also increase the pain. And then this impacts how we behave, right? If you're dealing with negative thoughts, we're having lots of negative emotions, we're having this pain day after day, it's going to really start to impact our behavior and our functioning. So someone who's dealing with pain all the time, it's probably going to start to impact their job, their social relationships, their hobbies. And so we start to see functioning day to day getting impacted too. And then we can see how if someone is really struggling with functioning, it's going to kind of relate back to those negative thoughts. So cognitive behavioral therapy is really kind of breaking down these pieces, and we'll see how some of the skills kind of map on to our thoughts and our feelings and our behaviors in this type of treatment. We can go to the next slide. Many folks have never heard of pain psychology, which is totally okay, but it is a really great field to be a part of. Pain psychologists often work as a part of interdisciplinary teams. So if you're seeing an expert, maybe in the medical field, like a physician or a pain physician or a neurologist, they may also have a psychologist who's a part of their team, who's really focusing on that non-pharmacological pain management piece. Pain psychology can be a little bit confusing for folks to hear about. Oftentimes, especially folks, who deal with tics and pain may have not always had the best experiences with the healthcare system or with different providers. And so when you hear, maybe a medical provider saying, hey, I want you to go see a psychologist about your pain, you might have some reactions to that, rightfully so, right? Oftentimes folks think that seeing a psychologist for pain means that their provider thinks that their pain isn't real, or it's all in their head, or it's a psychological problem. And I want to really assure you that that is not the case. So when you're working with a pain psychologist, what we're really trying to focus in on is how we can help and teach strategies to manage the pain. And we also look at pain from a biopsychosocial framework. So typically and historically, we always sort of looked at pain from that bio framework, really kind of focusing in on what's going on in the body and specifically what is the medical recommendation or the medication that's going to help. But over time, we realized that when we really only focus on that one aspect of pain, we miss the two other aspects that influence pain a lot, which is the psychological and the social factors. So we know that pain impacts everyday life, right? It impacts mood. It impacts people's thoughts and feelings and functioning. And so we have to really look at all those aspects of pain to treat pain in the best way. Pain psychologists use different evidence-based treatment strategies to help both with managing that pain, coping with pain, as well as trying to really improve functioning and quality of life. We can go to the next slide. With pain psychology, some of the things too that a pain psychologist may really explain and work on if you're working with one of them is talking with folks about how pain is experienced and what impacts pain. I think it's really powerful when folks have an understanding of what pain is and how the brain impacts pain. And so, pain psychology really breaks that down and helps folks understand how different parts of the brain are involved in pain and how there's different factors that can increase or decrease pain. So, just kind of thinking on a basic level here when it comes to pain, we know that the brain is a key player with pain. We tend to think of pain as just solely living in our body, right? If I have, shoulder pain, I'm thinking of that pain as being in my shoulder and that's where it is and that's where it lives. But what we know is that that's only partly true. Pain really occurs, exists, and is processed in the brain. And so there's different parts of the brain that can impact our perception of pain. One is our prefrontal cortex. This is a really important part of the brain. It has a lot of different functions, but the one that I want to highlight for us is its role with attention. And so this part of the brain helps us really hold our attention on something, and it also helps us process pain. So, what we find is that when we're really, really focused on something else and we're taking that attention away from the pain, that actually tends to result in our pain perceptions going down. This part of the brain gets so focused on something else that it just can't pick up on all the pain signals at the same time. In fact, when they surveyed folks who were experiencing tic pain, one of the biggest things that people reported was most helpful was distraction from that pain. We also know, though, if we're really paying attention to the pain, if we're really focusing in on it, we're thinking about it, we're not distracted, that allows all those pain signals to get processed and we might have higher pain. We also know that our limbic system or our brain's emotion center plays a role in pain processing. So, what this means is our emotions impact our pain. Our emotions don't cause our pain, but they impact it. They can increase or decrease those pain perceptions. So, if we're having a lot of negative emotions, we're feeling stressed, we're feeling frustrated, angry, that can increase that pain sensation. But when we're having more positive emotions or we're feeling relaxed and calm, that can help kind of turn down the pain. Our thoughts, believe it or not, can also impact our pain. How we think about our pain can matter. Our cerebral cortex plays a role in higher order thoughts and thinking and also helps us process pain. So if we're having a lot of negative thoughts about the pain, which again, normal, natural, to be expected, those types of thoughts can increase that pain experience. Things like nothing's going to work, I can't handle this, my pain is going to, throw off my entire day. Those kind of negative thoughts can unfortunately make that pain worse. When we can learn to have more neutral thoughts about the pain or more coping focused thoughts, things like I can handle this, I can use my skills, I've gone through bad pain days before and I'm still here, those kind of thoughts can actually help that pain. So we talk a lot about this because I want people to understand how that brain impacts pain and why a lot of the skills that we work on, deal with things like emotions and thoughts and attention to pain. We also talk a lot about how stress and pain are related to one another. So oftentimes, it can be really frustrating to hear something like, oh, your stress is making you have pain. And that's not the case. But we want to know that stress and pain, they are related to each other. They do impact each other. We want to think of pain itself as being a stressful experience to the body. So your body doesn't like to have pain as much as you don't like to have pain. So when we're having high levels of pain, that's really stressful and hard on our body. So as pain tends to go up, that stress response or our body's reaction to stress goes up. And then we also have a life, right? You all have a million things that you're balancing and dealing with and other things that can increase that stress. And because pain and stress tend to go hand in hand and relate to one another, as that stress does further go up in the body, that can increase that pain and those pain perceptions. But the good news is when we can learn ways to lower stress, that can help dial down that intensity of the pain. We also know just from reports of people who have Tourette syndrome and who have tic-related pain that heightened negative emotions tend to make that tic pain worse, and that they've found that stress reduction strategies can help alleviate some of that tic pain. So it's an important relationship to be aware of and something that we target. You can go to the next slide. What I do is pain-focused cognitive behavioral therapy, also known as cognitive behavioral therapy for pain or pain management. When we're thinking about what this involves, these are some common strategies. So these are some common areas and skills that you might learn if you were to work with a provider that was experienced in pain-focused CBT. You'll see that the strategies are in 3 categories. So we have relaxation strategies. This is really targeting that mind-body connection. We have behavioral strategies. This is targeting coping and functioning. And then we have cognitive strategies. These are our thought strategies. If we think back to a couple slides ago, there was that chart where I was showing you all with the thoughts and the feelings and the behaviors. We can see how these strategies map on to those different areas. I'm not going to touch on diaphragmatic breathing or guided imagery just yet, because we're going to learn those skills together today, and we're going to get a chance to even practice them. But I'll start with progressive muscle relaxation. And I'm just going to give a little overview of each of these skills. So progressive muscle relaxation, this is a skill that helps people really differentiate between what a relaxed muscle feels like and what a tense muscle feels like. And what is done is you guide someone through intentionally tensing and relaxing their muscles. And as they do this, it's both a relaxing experience because it's reducing that muscle tension. And we know muscle tension can also increase pain, but it also just helps people recognize early signs of tension in a muscle. So if between, after you learn that skill, you start to recognize that tension early on, then you're able to more easily relax it before it tends to increase. With some of our behavioral strategies, a couple of the strategies that you might learn in this area, one is behavioral activation. This is really to help people, especially when their functioning has been really impacted by pain. So we know that pain day after day really impacts daily life. It can really impact people's engagement in relationships and hobbies and things that they once really enjoyed doing. And as that happens, mood tends to take a hit. So behavioral activation is designed to really help people strategically and slowly start to schedule activities that they enjoy. So let's say, I'm working with someone who they used to, every Friday night play video games with their friends online and they loved it. But now with their pain, especially their pain in their arms and their shoulders, they just really haven't been, doing that as often. We would want to think about, okay, could we start to do this again? Could we kind of gradually schedule this for just a little bit of time to see if this is something that can help take your mind off the pain, boost your mood, and start to kind of slowly get you back into some of those things that you enjoy. When we do things, even in the presence of pain, we help retrain our brain's pain system and desensitize it to some of that pain. So even if the person I'm working with may have some pain that day, we'd really want to still try to play those video games because we're teaching our brain that we can still function even if some of that pain is present. And at the same time, we're boosting mood and we're distracting. We can also teach specific distraction strategies for pain. So really working with people to understand what helps distract you the most. Is it drawing? Is it coloring? Is it reading? Is it talking to someone? Is it games on your phone? Like, what do you find distracting? And let's use that to help take our mind off the pain and redirect our brain's attention away from the pain. We also teach a skill often called activity pacing. This is another skill that helps people function in a really gradual and gentle way. So like I mentioned earlier, it is hard to function with pain, right? So we want to be mindful of that And when we're asking people to do an activity or to do something that they need to do, but they have pain, we don't want people to overdo it and make that pain worse. So let's say, for example, I have a patient that I'm working with and they have a shoulder tic that's leading to a lot of shoulder pain and arm pain, but they have to type up an English paper that's due tomorrow. We would want to brainstorm together and use our pacing skills to break this activity down. So, what that might look like is I would say, okay, how long do you think you can work on this paper before that pain starts to go up? Let's say they say I can work on it 10 minutes before I may start to notice that pain getting worse. Then what we would want to do is make a schedule where we're working on that paper for 10 minutes, then we're stopping, we're taking a little mini break. This could be we're going to do a relaxation skill. This could be we're going to do a distraction tool. Maybe we just get a little snack or something to drink. Then we work for another 10 minutes. Then we're going to pause again and take another break. And we're just repeating that until we're done. And when we pace things out and we take those breaks, it stops that pain from continuing to go higher and higher and higher and helps people function in a more paced out and gentle way. We also teach cognitive strategies or thought strategies. So, like I'd mentioned earlier, it's very common that we have negative thoughts related to pain. That's just how our brain tends to react to pain. So we may work to develop specific pain coping thoughts. These could be things like, I can handle this, I will use my skills, I will just do what I can today, and that's okay. But really having specific coping thoughts that someone can use on a high pain day or a bad pain day just to help them get through. And we know that when we have those coping thoughts, that leads to more positive emotions. We're able to regulate that stress better, and that has those benefits for pain. We also teach specific cognitive restructuring strategies. This is where we help folks recognize if a thought is occurring and it's not helpful and it's not true, we got to really learn how to talk back to it and challenge it. So we teach people how to challenge the thoughts that they have to then come up with more helpful thoughts or more coping focused thoughts. So that's just a quick little overview of some of the strategies that you might learn in working with someone. And we can go to the next slide. What we're going to do next is we are going to go a little bit more in depth on two of the skills that you might learn. One is diaphragmatic breathing and the other is guided imagery. So we can go ahead to the next one. So I know what you might be thinking, seeing that I'm teaching a breathing exercise. You might be thinking, oh my gosh, is she really thinking that how I change my breath might help my pain? And I get that. You might be having a reaction to that. I get it completely. This is a special form of breathing and a special breathing technique that has evidence behind it for reducing pain. So bear with me, all right? So diaphragmatic breathing is a different way of breathing than we typically do day to day. When we are asleep at night, our body kind of naturally transitions to this type of breathing. But during the day, we're more commonly chest breathing. Our shoulders are moving up and down. Our chest is moving in and out. So when we can learn to do this technique during the day, it really sends messages to our brain to help it to calm down and to relax. And we know that when we are calm and we relax, that can help take the edge off the pain and help reduce some of that stress in the body. When people do diaphragmatic breathing on a daily basis, just even for a couple minutes at a time on the daily, we tend to see that pain starts to go down over time or is less intense. But we can also use diaphragmatic breathing in the moment to help take that edge off the pain. So with diaphragmatic breathing, we have this muscle called the diaphragm. It's kind of towards the bottom of our rib cage, sort of sits below our ribs there. And when we're doing diaphragmatic breathing, when we breathe in, that diaphragm actually goes down and that pushes our stomach out. When we then exhale, it goes back up and our stomach goes back in. So when we're doing this type of breathing, our chest is really still, but our belly is moving in and out. I often tell people, imagine you have this big balloon in your stomach. And as you are breathing in, that balloon is just expanding and filling up with air. And as you're exhaling, it's going back in. Now, with belly breathing, it can be a little bit tricky when you're first learning it, and it might even feel a little like unnatural and funky the first few times you do it, because again, we're not used to breathing in this way. But with practice, we can start to get it really, really nice and smooth. So when we're first learning about diaphragmatic breathing, this is how I like to teach it. I want you to first try to find where your diaphragm is. How we're going to do that, and I'm going to kind of attempt to stand up here. We are going to put our 2 fingers, if you want to join me and do this along with me, I want you to put 2 fingers a little bit below your ribs, but above your belly button. Kind of put them firmly on your belly there. And then take a couple quick breaths in. Like when you take a couple quick breaths through your nose, you should kind of feel this move a little bit, move in and out. That's where we're really focusing on when we're doing this belly breath. That's where we're really going to feel that movement. When we're first learning it, it's really helpful to take a couple different positions to practice. So one that's often helpful when we're first learning is to put one hand on the chest and one hand on the belly. We put one hand on the chest because we don't want to feel this hand move. And if we feel this hand moving when we're breathing, that means we're doing more chest breathing than belly breathing. So we want to have one hand on the chest and one hand on the belly, okay? And then what we want to notice is when we breathe in, we should see this belly hand go out and then go back in as we exhale. Now, when we're breathing in, we want it to be a nice slow breath in. You want to imagine that you are smelling something just so amazing and you just want to take it in slowly. I like to imagine that I'm smelling like freshly baked cookies, or you can imagine your favorite flower, whatever scent you like. So as you're breathing in, you're taking that nice slow breath in. And as you exhale, you want to take a nice slow exhale out. If you're breathing out through your mouth, you can kind of imagine that you're trying to really slowly blow out a candle. That'll kind of help you keep a nice pace. So I'll demonstrate for you. This hand should not move. This hand should move. So first, I'm just going to empty out my air. And first, I'm going to take a nice big belly breath in and then out. I'll show you once more. Big belly breath in and then out. Hopefully you could kind of see, I know I'm a little small on the screen, the belly kind of moving in and out. Another position that's good when you're first learning is to actually put your hands behind your head. I know this looks a little bit silly, but when we do this, it locks our chest in and it makes it easier for that belly to move in and out. Another way you can practice, and you could even try this later today, you could lay nice and flat, either on a bed or couch. And as you're laying nice and flat, sometimes it's easier to kind of watch that belly move up and down. Some folks find that it's a little easier to make that movement happen. Aside from really having that belly move in and out, we want this breath to be nice and slow and controlled. And I'm going to show you guys in a few slides from now a couple breathing pacer apps. These are apps that you look at while you're doing your belly breathing that really control the pace and rhythm of the breath. So you look at the app and an image will come up on the screen and it'll tell you when to inhale and when to exhale. And you follow along with that as you're doing your belly breathing, and that'll help you keep it nice and slow and controlled. The more you practice this, the easier it will get, I promise. So if the first times you're practicing it, or if you've been following along with me, if you're like, oh my gosh, this is kind of confusing or it feels a little funky, bear with me. It gets easier as your brain kind of adjusts to what that movement is, and you kind of get that good practice with it. So that is diaphragmatic breathing, and I'll show you some of those app options out there too. So you can go to the next slide. The other skill that we're going to talk about today is guided imagery meditation. This is a skill that also has evidence behind it for helping to reduce stress and to reduce pain. I really like teaching guided imagery for tic pain because it is a really distracting tool as well. So it's relaxing and distracting two things that can help benefit pain. Guided imagery meditation really focuses on the fact that when we imagine something in our brain, we can change how we're feeling. And oftentimes, when we imagine something in our mind, our body and our brain react in a similar way as if this thing was actually happening. So I want to kind of give you guys a little example of how this works, how our brain can kind of create an image and change how we're feeling. So I want you all just to kind of take a quick second here. And if you're comfortable with it, I want you just to close your eyes. Okay. Now, with your eyes closed, I want you to imagine that I have a really big chalkboard next to me. And I want you to also imagine that I have these super long fingernails. And I decide I'm going to be the meanest presenter ever. And I start slowly dragging my nails down the chalkboard. You can open your eyes. I'm sorry for doing that. But think about how it made you feel. Maybe you felt a little tense. Maybe you kind of cringed a little bit. You kind of noticed feeling a little icky or off. But I didn't have a chalkboard or long fingernails. Your mind created that image and your body reacted and responded, and it changed your emotions. I promise you, we're not going to imagine any more images like that. We're going to be imagining peaceful, relaxing, calming things going forward. But with this, when we imagine those peaceful, calming, relaxing things, it helps us to feel peaceful, relaxed, and calm. There's two main ways that we can try guided imagery. One is we can make our own, and we'll kind of walk through how to do that. And the other is we can listen to guided recordings where people are describing for us a peaceful place. We can go to the next slide. So one way to do guided imagery is to create your own. I like to also call this kind of like taking a brain vacation. So what this involves is you think of a place, and this could be a real place, this could be a made-up place, this could be a place you went on vacation, a park you like, a room in your house. Could be a totally made up thing like floating on a cloud. But I just want you to think of something, a place, a calming image for you. And that when you think of it, you just feel relaxed and calm. And what we're going to do is we're going to kind of pretend that we're there. We're going to kind of go in our mind to this calming place. And we're going to think about all of our senses if we were there. So we're going to go through each of our senses, our sight, our hearing, our taste, our smell. And we're going to imagine that if we were there, what would we be experiencing? So if you're up for practicing this along with me, I want you to kind of think of a place, nice, calm, relaxing place. It's peaceful, it's safe to you. And if you feel comfortable, you can close your eyes or you can look down at the floor or at your hands, whatever feels right. And I want you to go to your calm place in your mind. I want you to get into a nice, comfortable spot. You can gently close your eyes and just kind of go in your mind. Take that brain vacation to your calm, relaxing place. Once you have your place in your mind, I want you to think first about what you would see if you were there. So I want you to really look around your peaceful, calming place and just notice anything that you can see around you. And as you're looking around your special calm place, see if you can hear any sounds. See if there are any sounds around you that you notice. And as you're spending time in your place and you're noticing what you can see and you can hear, I want you to see if you notice any scents or smells. Are there certain smells around you, certain scents? And if you notice some scents, I want you to also see if there's anything that you can taste. It might be that you're eating or drinking something. Might be a lingering taste of something that you had earlier. But in your special place, I just want you to notice if there's anything that you can taste. And then I want you to notice if there's anything around you that you can touch or feel. Maybe you're sitting somewhere that you can feel. Maybe you feel a breeze or the temperature around you. I want you just to see if there's anything that you can touch or feel. And now I want you to think about how you feel emotionally in your safe place. Maybe you feel peaceful, relaxed, but take a minute to really notice those emotions. And whenever you're ready, you can come back from your special place and you can open your eyes. This is just a quick little reset, a quick little brain vacation. So this is something that, perhaps you're noticing a lot of tic pain in the moment and getting really frustrated, and you just want to take your mind off the pain for a couple minutes. A lot of folks like to do this before bed, so they may just kind of unwind and relax and think about their special place as they're trying to fall asleep. But we can really just kind of take that time whenever we need to just sit back and just kind of imagine that place and go through each of your senses. We can also practice this skill by listening to different recordings. Now, with the recordings and meditation, I want to give you a heads up that meditation is hard. If you've never done it before, it's kind of hard and it takes some getting used to. It is really hard to hold your attention for several minutes. So this meditation is a quick one. It's about 5 minutes long. And they're going to walk us through imagining that we are on the beach. Now with this, when you're listening, your mind may start to wander, and that is okay. You might start to think of things that you still have to do tonight or things that happened earlier in the day. And I want you, whenever your mind starts to wander, just try to bring it back to the sound of the meditation. You didn't miss anything. Just kind of pick up where you are. But I also want you to know that it's okay to move. So if you're sitting and it's hard to kind of stay still and, stay in one position, it's okay to stretch. It's okay to fidget. It's okay to move around a bit. Just get into whatever kind of works for you, whatever's most comfortable. I'm going to have Alexandra then press our meditation here in a second. And we're going to have a chance just to kind of sit back, relax, and listen. So when she turns that meditation on, I just want you to sit back, relax, and just see what you think of it and see what it's like for you.
I'm going to take you for a walk on the beach, and you're going to use your senses and your mind's eye to experience that walk. All right, cue the waves. All right, here we go now. Once again, we're going to close our eyes. We're going to fall into our breath, and then just listen to me, and I'll take you for a walk on the beach. Just go ahead and fall into the rhythm of your breath once again. Now I want you to imagine that you are walking along a path leading to the ocean. And as you're walking, you're starting to hear the waves and to feel a gentle breeze. You find yourself at the end of that path, stepping into soft, cool sand. Feel the sand around your feet and your toes. And while you're standing there, just notice the direction of the sun, where it's warming your body, direction of the breeze, gently kissing your skin. And maybe look up at the sky. Notice the beautiful blue of the sky and soft clouds floating by. Just take in this moment on the beach. Maybe taking a big breath, smelling all the scents of the beach, the salt water, maybe even in the distance some suntan lotion. And now begin walking towards the shore. Become aware of the sand beneath your feet as you walk towards the shore, listening to the waves, enjoying that rhythmic sound. And then find yourself putting your feet in the water. Feel the little waves lap against your feet and your ankles. Perhaps you could splash your feet a little bit, just enjoying the water. Looking on the horizon, noticing any boats or birds. Watching the waves gently break one after another. And now walk along the shore, enjoying your feet in the water and looking for small treasures as you go. Some beautiful shells. As you see them, pick them up and hold them in your hand. Feel them, notice them. Perhaps there's one you'd like to put in your pocket to take home with you. Just walk along the shore using your senses to experience every aspect of the beach. Feeling the breeze, hearing the birds. Perhaps there's children laughing in the distance. Just notice how relaxed and joyful you feel as you walk along the beach, releasing all tension and worry. Just enjoying this special place. Noticing the seagrass move with the wind. Now just stop and listen to the waves. Imagining with each break, the ocean cleanses you of any unpleasant feelings or emotions, taking them back out to sea as you become more and more relaxed. Just listening to the waves for a moment. Invite this relaxation to remain with you for the rest of the day. And once again, slowly open your eyes.
All right, so I hope that you all had a chance to kind of sit back, relax, and listen during that. I know the first few times we do guided imagery might be a little bit confusing for your brain or a little bit to adjust to. But I also want to assure you that there are a lot of good options on YouTube and some apps that I can show you as well. So if beach imagery isn't your thing, I get that. Or if you like certain voices and sounds more than others, there are a lot of great options available for you. So we can go ahead to the next slide.
I'm going to take you for a walk.
So these are just some apps and resources that I wanted to share with you all. These are some free apps that are really nice to kind of just continue some of your skill practice. So if you were interested in some of the skills that you learned today or you found them beneficial, these are some apps that can be helpful in that practice. The first two apps listed there, these are breathing pacer apps and they're free. Breathe Plus is available for iPhone and it's a breathing pacer app where it has an image that goes up and goes down. And so if you're doing your belly breathing or diaphragmatic breathing, you can watch that image as you're doing it, just so that you know you're keeping it nice and slow and controlled. Breath Ball is a really good option for Android. With this one, it's a ball that goes in and goes out, and it just guides you through again, giving you something to look at. Sometimes it's helpful with the breathing to have an image to look at that kind of helps it be a little bit more distracting too if we're really trying to take that attention from the pain. 5-Minute Escapes is a free guided imagery app. You get several free 5-minute long guided meditations on that app. They are basically somewhat similar to the one that you heard. There's a nice one of a garden, a sailboat, a beach, and it's someone describing these peaceful places with sounds. Smiling Mind is a free app that has additional types of meditation as well as guided meditations too that you can use for practice. And Relax Melodies is nice if you're someone that likes more just kind of having like nature sounds and relaxing music, but you don't love the voices as much. Relax Melodies is great if you just want to kind of sit back, go to your special place in your mind, but you want some sounds in the background too. Now, if you're really interested in CBT, I recognize it is very hard sometimes to find a pain psychologist or to find a CBT for pain provider. And so I am eternally grateful that Dr. Rachel Zoffness, who is an expert in chronic pain, she's a pain psychologist, made a self-guided workbook. And so if you can't find a provider or you just want to kind of do some of this on your own pace and learn some of these skills in more detail, you can get this workbook online. I know it's in Amazon available there. It's the Pain Management Workbook. And it's completely self-guided. There's worksheets, there's recordings that you can access online. And it is a great way to learn the CBT skills if you don't have, access to a provider or you want to just kind of go at your own pace. And then if you're looking for some more free resources, Chronic Pain Champions has both a free ebook as well as a Facebook support page. So Chronic Pain Champions was created by a man who experienced chronic pain, who went through an interdisciplinary pain program and created an ebook of just all the insights that he learned about chronic pain. It talks a lot about, pain psychology and that sort of thing too. And then there's a Facebook support page that anyone can join. And it's a really kind of supportive coping focused page. And so you can connect with other people who are dealing with pain. Okay, we can go to the next slide. These are just some of my references for you. And then we can go to the next slide.
Amazing. Thank you so much, Dr. Love, for a great presentation. I have to say the relaxation video almost put me to sleep.
It's late, it's the evening.
So as promised in the intro, please view the QR slide here. You can use your phone to scan that and complete a brief survey. We greatly appreciate your feedback, and it does allow us to have future programs like this. You'll also see, and it will be placed in the chat, the ability to donate today. Again, we greatly appreciate any donations that you may feel able to make at this time. Last but not least, we want to hear from you. It is our greatest goal to only put on programming that is requested by the community, not programming that we think the community wants. So if you do have any ideas, if you like what you saw today and want to see more of it, please reach out to us at programideas@tourette.org. With that being said, I'm going to pass off to Chantel, and we can start the Q&A portion of tonight's program.
Sure. Thank you so much, Alex. Our first question, and please let me know if you need me to repeat it, Dr. Love. Our first question is, do you suggest somatic tracking for TS pain?
I think that's a really great question. I myself don't typically do somatic tracking. I use more of a mindfulness-based approach, but I have heard of somatic tracking as a part of pain reprocessing, and there's a lot of great evidence behind it. And the goal with it is really that it's helping to kind of desensitize your brain from taking pain as being really threatening to seeing it just more from a neutral framework or being in a more kind of relaxed state. I myself don't have a lot of specific training in it, but I could see how it could be really helpful for tic pain. What I'll often use is more of a mindfulness-based approach, and this is noticing the pain but not reacting emotionally to it. So it's quite similar, but with the mindfulness-based strategies, we're working to kind of approach the pain with curiosity versus that emotional reaction. So like, let's say I'm having, a lot of ankle pain and I'm feeling really frustrated by it, I would simply kind of react in a way of, okay, I'm noticing that I'm having some ankle pain today. I know that the pain kind of tends to come and go versus, oh, why am I having this pain? Why is it not getting better? This is really going to throw off my whole day. Like it's kind of taking this mindfulness based approach. So I could definitely see how that pain reprocessing and somatic tracking could be really useful too.
Perfect. Thank you so much. Next question. How do I deal with shoulder pain from twitches? And how do I handle other symptoms such as pain in the eyes as well?
Yeah. So I think the good news is, as frustrating as pain can be, especially when it's in all different parts of the body or related to different areas, we want to kind of think about these skills as being pretty universal when it comes to pain. So the good news is that the skills that we talk through today are good really regardless of the location of the pain, where it's at. I also think too, it's always good to consider interdisciplinary approaches to the treatment of pain. So oftentimes, especially if that pain is really musculoskeletal, a lot of my patients may also see a massage therapist who has good experience too, and kind of combining some of those strategies with that as well.
Thank you so much. Next question. How do I help calm my tics down once the pain starts to get bad? Because then I am more aware of that body part and tic more.
Yeah, yeah. And I think that's where distraction can be really good, oftentimes using that distraction and that relaxation together. So I would recommend really kind of noticing early on, when is that pain starting to increase? When are those tics starting to increase? What's a skill that you could use that could help both relax and distract? And maybe it is that you're going to just take a pause and do some diaphragmatic breathing, pull out your app and be looking at it while you're doing that breath to distract from the pain and relax. Maybe it's you're going to try one of those meditations from today, really kind of thinking about taking that active coping approach to help redirect that brain's attention from the pain.
Thank you so much. Our next question. I am the fiance of an adult with TS and am interested in learning how I can assist in his pain management.
Mm-hmm. Yeah. So I think, if your fiance is open to learning some of these skills and, you want to share some of these tools, I think that could be a really nice start. I also wonder too if, maybe that pain management workbook could be a good idea as well, where maybe both of you could kind of go through it together and learn those techniques together. I know sometimes some folks don't like to be prompted to use their skills or reminded, but kind of figuring out what works for the two of you, if it's okay for you to kind of say, hey, why don't we try one of those, relaxation strategies or distraction techniques, or if he's okay with that, or if he wants to kind of, learn some of those skills on his own, whatever sort of works for you all, but kind of taking those coping skills and applying them.
Okay, thank you so much, Dr. Love. And the last thing is not a question, but it is a comment. And it says, this is Dr. Hermitet, and I just wanted to say how proud I am of Dr. Love and how essential she is to our TS/pain community. She is a national expert on this topic. So happy to have her here on this Thursday night.
Oh, that is so lovely. Thank you so much. I appreciate that a ton.
And I will go ahead and hand it back to Alexandra.
Amazing. Well, thank you so much, Dr. Love, again, for your presentation and for answering those questions so thoughtfully. We greatly appreciate you tonight, having you tonight, I should say. For everybody who is on, thank you for noting that the QR code maybe had some troubleshooting issues. I did drop that link again into the chat. We do, again, really appreciate you taking the time to fill out the post survey for tonight's program. And if you have any questions, you can always find us at programs@tourette.org, which I will also place in the chat. And then at this time, the program is complete, and we thank you and hope to see you again soon.
Thank you all.
Thank you.